My name is Dr. Monica Peak, and I'm an associate professor of medicine at the University of Chicago. There are many things that we can do to improve the overall healthcare system for people who live in the United States. But if I had to think about the top five, I would start out first with the integration of medical and social care needs. And what that means is that healthcare institutions really need to prioritize thinking about addressing the underlying social and structural determinants of health that impact the disease and death rates for many people in this country. Doing so acknowledges that these are the things that account for much of the chronic diseases and death in this country, and we're not going to get to a healthier population unless we start thinking about root causes, things like food insecurity, lack of housing and transportation, things like that, and have that be a goal that the healthcare system, along with many other systems, has on our radar. Second, in light of how we are trying to address these issues, we have to start redefining who is properly a member of the healthcare team, and employing people who have the shared lived experience and the skills to interact with many marginalized populations who are burdened excessively by these structural determinants of health. Is going to be a way that we can reach these populations and help them navigate through and above these structural determinants, and help them navigate their way through healthcare barriers to health. For example, if they don't have health insurance, and again, for those who have unstable housing, those who need assistance with transportation to their doctor's appointments, things like that. Having a diverse healthcare team with lived experiences in some of these challenges, who are from the community, will help engage those typically hard to reach populations who are living in extremely trying circumstances. And so we need to think of these workers as social bridges to the very people who we're trying to reach, and not just have them work in a volunteer capacity, but have them be core parts of our healthcare team. Third, we need to make sure that all of our healthcare employees have a good foundation in what we call structural competency. And that means that we have a deep understanding, or at least some understanding, that people's health is frequently a function of structural systems, of policy choices. And so that when we see people coming in with poor health, that we don't immediately look to blame the victim and say, oh, this person just must not care about their health, and look for individual solutions, and look for individual blame, but instead take a step back and think, take a systems approach like we do for many chronic conditions, and think about what systems have not been in place to meet the needs of this individual, what systems have failed for us to have entire populations who have significant disparities in health outcomes. And so having a better understanding of those kinds of policies and structures, having a structural competency in addition to cultural competency, helps us better be able to engage in the structures around us to better serve our patients. Fourth, I would say that we need to make sure that we're engaging in interventions that are culturally responsive. Certainly, quality improvement will help everyone along, but certain populations are going to need to have programming that is socioculturally tailored to their lived experience. And the data has shown that, has bared that out, that people do better when programming resonates with them from a linguistic perspective, from a cultural perspective. And so we want to have that kind of programming feel like it's made for them and tailored for them, because they'll have better uptake and utilization of whatever healthcare programs, goods, and services that the population needs. And then last, I just want to remind everyone that at the end of the day, it's all about patients and patient care. And we can have all of the medicines, all of the bells and whistles, all of the tools and technology, but if patients don't feel loved, respected, and cared for by the healthcare system that is delivering that care, it is all for naught. Teddy Roosevelt had an excellent quote that I think about all the time, that no one cares about how much you know until they know how much you care. And so for our patient population, when we lean in and lead with our heart, then the knowledge that we're trying to transfer will more easily follow. And so I think those 5 things are the most important things that we can begin to address that will help our patient population overall, but particularly the most marginalized who are suffering the most from disease and disability and death in this country. Thank you.